Good afternoon and welcome to the University of Illinois at Chicago Global Health Colloquium. Today's topic, the impacts of war on health, human rights, and the environment, will be presented by Dr. Barry Levy. It gives me great pleasure to introduce Barry. We first met back in 1992 as part of the World Bank environmental mission to Ukraine, and reconnected this past year after the Russian invasion of Ukraine to speak about the effects of the war on health and environment at the Colloquium Ramazzini meeting in Italy, at the American Public Health Association meeting, and co-authored the Colloquium statement condemning the invasion of Ukraine. Dr. Levy is a physician and epidemiologist who has written and spoken extensively on the impacts of war on health, human rights, and the environment. His latest book, From Horror to Hope, Recognizing and Preventing the Health Impacts of War, addresses these issues from a public health perspective. Barry has edited 20 previous books on the health impacts of war and terrorism, climate change, occupational and environmental hazards, and social injustice, and has written more than 250 journal articles and book chapters. He has written about the war in Ukraine in the New England Journal of Medicine and elsewhere, and has spoken on the war for the National Academy of Medicine, the American Public Health Association, the International Physicians for the Prevention of Nuclear War, and other organizations and institutions. He's an adjunct professor of public health at Tufts University School of Medicine and a past president of the American Public Health Association. Barry?
Wonderful. Thank you very much, Dan, and it's wonderful to be with you all today, especially during Public Health Week, given that war is such a major public health problem that really isn't given enough attention to in academic institutions, in government agencies, non-governmental organizations, particularly with regard to the health impacts and the impacts on human rights and the environment. So I want to start with an eyes closed exercise, and I'd like you to close your eyes, and I want you to imagine what it would be like to be living in a war zone. Or if you have lived in a war zone, I want you to recall what it was like. Keep your eyes closed. What do you see? What do you hear? What are you worrying about? How will you react when family members are attacked or injured? What will you do when the food runs out or the water stops flowing? How will you get the medicine that you need? How will you get help when your phone doesn't work and the internet is down? Well, where will you go when your home is destroyed? You can open your eyes now. This exercise is over. But for many people, this is not an exercise. It is the reality of living in a war zone. That reality is true in many countries throughout the world. For example, in 2021, there were armed conflicts in 46 different countries, according to the Stockholm International Peace Research Institute, which keeps statistics on war and military expenditures and so forth. 1/4 of people worldwide live in regions directly affected by armed conflict. Most wars today, in contrast to the war in Ukraine, which is an international war, a war between countries, most wars are civil wars that take place in low and middle income countries. And in most wars, the vast majority of deaths are among civilians, unlike the situation perhaps 100 years ago when the vast majority of deaths were among military personnel. And finally, one of the things that characterizes most current and recent wars is that many people, often millions of people, are forcibly displaced. For example, in the war in Ukraine, up to 12 million of people have been displaced either internally or have crossed borders into neighboring countries. This graph shows displaced people worldwide for a variety of reasons between 1996 and the year 2020. It does not show data over the last 2.5 years. The upper line on the graph are internally displaced people who make up the majority of displaced people. The middle line are refugees who have crossed international borders and are given certain protections as when they become refugees. And the bottom line are asylum seekers. These numbers are much larger since the onset of Russia's invasion of Ukraine. There are now approximately 103 million people worldwide who are displaced. And when we look at statistics, we need to be reminded that statistics are people with the tears removed. And as we talk about war and many other public health problems, we need to have a balance between talking about statistics and talking about the real people behind those statistics. In war, direct deaths are often due to indiscriminate attacks. Attacks such as the carpet bombing of Osaka, Japan during World War II. And indeed, both the Allies and the Axis powers during World War II engaged in carpet bombing, killing numerous people, millions and millions of people, indiscriminate attacks, although they were focused on areas where people lived and worked. Here's another example of a boy in Cambodia with an amputee as a result of a landmine, again, the result of an indiscriminate attack. And another result of an indiscriminate attack, this is a 10-year-old boy in a Cambodian refugee camp in Thailand many years ago. You can see a scar on his abdomen and another scar on his left shoulder. He was crossing the border carrying his 4-year-old brother. He survived this indiscriminate attack. They were going through an area where there was fighting going on. His 4-year-old brother, however, was killed. But increasingly during war, there are targeted attacks against civilians. This is a village in Darfur, Sudan, that was attacked by a targeted attack. This is a targeted attack on a hospital in Kharkiv in Ukraine. Increasingly, there are more targeted attacks on civilians than civilians dying of indiscriminate attacks, because civilians are targeted during a war. And then there are the indirect health impacts of war. As I'll show in a moment, these indirect impacts, malnutrition, communicable diseases, non-communicable diseases and exacerbation of them, adverse effects on reproductive health, and mental behavioral disorders. In the aggregate, these account probably for much more morbidity and mortality than the direct attacks with, be they indiscriminate attacks or targeted attacks with explosive weapons. Here's some of the evidence that shows that they're more frequent. Mohammed Jawad and his colleagues in BMC Medicine published 3 years ago a paper in which they estimated indirect deaths among civilians over a 28-year period. There were more than 1,100 armed conflicts. And by the way, I'm using the words armed conflicts and war interchangeably in this presentation. But they looked at, or they estimated deaths for more than 1,100 armed conflicts. And they estimated 29.4 million total deaths during this period, most of which were due to communicable, maternal, neonatal, and nutritional diseases, about 1 million a year. So this is an estimate of these indirect deaths. In comparison, the Uppsala Data Conflict Program in Sweden ongoingly records and documents deaths among not only civilians, but combatants as well. So these are documented deaths almost entirely due to the direct impacts of war as opposed to these indirect effects. And they documented about 50,000 deaths per year over the same period of time. Graphing these data shows that now the direct deaths no doubt are an underestimate, and it may well be that the estimated indirect deaths by Jawad and his colleagues were an overestimate, but this strongly suggests that the number of people who die during war as a result of indirect effects of war are likely far greater than those who die of the direct impacts, mainly of explosive weapons. A few words about each of these categories that I mentioned. Malnutrition affects not only children under age 5, but also other children and of course adults. And shown here is a 7-year-old girl in a refugee camp who weighed only 27 pounds. In fact, I did not recognize my 1-year-old son when I came home because he was a normal weight compared to the malnourished children that we were seeing in the refugee camp. Also at high risk of the effects of malnutrition are pregnant and lactating women, but we need to look at malnutrition as a problem that affects not only children, but people in other age groups and risk categories. Malnutrition occurs during war as a result of reduced food production. For example, right now in Ukraine, less food is being produced, in part because landmines have been deployed through much of the countryside, actually covering more than a quarter of the land area in Ukraine. Malnutrition also occurs because of damaged infrastructure, roads, markets, and so forth that have been destroyed, diversion or delay in the food supply, restricted food import, and very importantly, the use of food as a weapon, as it has been used by Russian military in Ukraine, restricting food from people who need the food. In fact, if we look back at the last 15 major famines in the world, 14 of them have been related to war, and in many of those, food was used as a weapon, many of those wars. Communicable diseases are primarily gastrointestinal diseases like cholera and shigellosis and other diarrheal diseases, largely because people cannot get clean water. Water supplies are often targeted. Water treatment plants are often bombed. This is a picture in the first Persian Gulf War in 1991, where women were getting water from the Tigris River because the water treatment plants in Iraq and in Baghdad primarily were bombed. Safe water was not available, and so people went to the rivers to gather water, knowing full well that the water may be contaminated with microorganisms or toxins, but nevertheless was the only water available. So gastrointestinal diseases are a major category of infectious diseases during war. So are respiratory disorders, particularly those that spread easily, like measles, COVID-19, tuberculosis, as a result of the fact that not only the disease prevalent in the population to begin with, but people live in crowded shelters and other places. This is a subway station in Kiev where many people went to avoid the bombing that has gone on very frequently in Kiev and other Ukrainian cities. A child with measles in the same refugee camp that I showed the malnourished girl a few minutes ago. Exacerbations of non-communicable diseases also occur during war, as well as increased occurrence of new onset of diseases such as respiratory diseases. So we're talking about cardiovascular disease, chronic lung disease, diabetes, etc. The World Health Organization did a survey in Ukraine not long ago and found that there was reduced access to medical care. In fact, they found that of the people surveyed, about half the people reported at least one barrier to accessing healthcare, most commonly cost. And in fact, that number of half was even higher in the areas that were occupied by Russian forces. The same survey showed that only 22% could not get the medications that they needed, mainly because of cost, availability, and long waiting times, medications for some common problems like hypertension and so forth. Now, going back to the slide of common non-communicable diseases, what this means is that people with hypertension without their medications during war are at increased risk of stroke and myocardial infarction and so forth. People with chronic lung disease, such as people with asthma, are at increased risk of getting severe attacks. As another example, people who are dependent, people with diabetes who are dependent on insulin are at increased risk of going into diabetic coma. These are the things that don't necessarily get reported or may not even be recognized as related to war, but indeed are related to the effects of war. Maternal and child health is another area of concern during war. Adverse effects on reproductive health occur largely because there's decreased prenatal care, decreased presence of trained birth attendants, decreased postpartum and neonatal care, and decreased access to other reproductive health services. And as a result, there are more complications of pregnancy and higher maternal mortality rates, higher rates of premature and low birth weight infants, higher infant mortality, and there's some evidence that, at least in some situations, some studies have shown increased occurrence of certain birth defects during wartime situations. Mental and behavioral disorders may in fact be the most prevalent and most long-term effects of war, at least many wars. We're talking about PTSD, depression, alcohol and drug abuse, and suicide. It's interesting, if you look in the literature, 4 times as many papers are written on the mental and behavioral disorders among military personnel than among civilians. And indeed, it may be civilians who are more severely and more frequently affected by mental and behavioral disorders. Many factors, of course, lead to this: physical and sexual trauma, witnessing atrocities, family separation, deaths of loved ones, forced displacement. We can make a long list of all the factors during war that lead to increased occurrence of mental and behavioral disorders. And of course, many people are psychologically scarred for life as a result of the exposures to war. This is a child in that same refugee camp in Thailand, a 12-year-old boy being held by a nurse from one of the relief agencies. He has a feeding tube in his nose because he refused to eat after actually witnessing the death of his parents, the execution of his parents. He was also unable to see. He was deemed to be psychologically blind, which is a disorder that has been reported in such horrendous situations. But this is an example of the kinds of mental disorders that people experience during war. Of course, there are many violations of human rights that occur during war. We've already talked indirectly about some of these: assaults on civilians, including sexual violence, attacks on hospitals, schools, and other civilian infrastructure. And I should add to this, attacks on civil and cultural institutions that represent the culture of a people. And of course, this has occurred in many wars. Deployment of banned weapons such as anti-personnel landmines and cluster munitions, deprivation of food, water, shelter, and healthcare, and forced deportation. Thousands of people have been deported by Russia from Ukraine into Russia, including many children, which is a clear violation of human rights and international humanitarian law. There are other important considerations with regard to current and recent wars. First among these is damage to the environment, about which Dan Ryarczyk knows a lot more than I do, and perhaps can add to what I'm saying here during the discussion period. But damage to the environment includes a number of things, including but not limited to fires and explosions, which release harmful chemicals into the air, water, and soil. And of course, destruction of industrial facilities, destruction of nuclear power plants also represents serious risks to the population when they're destroyed during war. This is a picture of a rocket that carries up to about 100 cluster munitions. Many of these munitions do not detonate. They represent unexploded ordnance, or sometimes referred to as duds, which represent long-term safety hazards to any people who are touching these bomblets or cluster munitions that don't go off initially. And as I mentioned, landmines are another example of the environmental impacts of war, especially where landmines have been deployed through so much of the countryside, as in Ukraine. Damage of the built environment is very important, as well as the natural environment, ecosystems, animal habitats, and as shown here, people habitats that have been targeted and destroyed. And I show here military vehicles which heavily use fossil fuels during war, which contribute to climate change, another environmental impact of war. Diversion of resources is something that is not often considered, but is an important issue. Dwight Eisenhower, Republican president in the 1950s, said it better than I can, certainly, in terms of the impacts that diversion of resources have on children and other civilians. These are the annual military budgets of the United States and some other countries. The United States military budget of over $800 billion is larger than the next 9 countries combined. So this again represents all countries that spend huge amounts of money on military purposes are in effect diverting resources that might otherwise go for civilian purposes, healthcare, education, social services, and so forth. As many of you know, Costa Rica, a number of years ago, eliminated its military, and it's no coincidence that it has among the highest life expectancies of countries in Central and South America, among the lowest infant mortality rates, and the almost one of the longest as I said, life expectancies and quality of life compared to many other countries that do have militaries. And finally, the threat of nuclear weapons. This is a blast that destroyed Bikini Atoll test in the Pacific many years ago. There are now 13,000 nuclear weapons possessed by 9 countries, 90% by the United States and Russia. Most of them are much larger than the bombs dropped on Hiroshima and Nagasaki. Even the so-called tactical or battlefield nuclear weapons are almost as large, if not larger, than those dropped on Japan at the end of World War II. They could be launched by accident or due to misinterpretation or miscommunication. There have been several close calls, you might say, where the former Soviet Union or Russia or the United States saw apparent warplanes, nuclear bombs approaching on their radar screens, and had only moments to decide whether or not to launch an attack on the adversary. We're lucky, many people have said, that we haven't accidentally stumbled into a nuclear war over the last 8 decades. Even a small nuclear war could lower temperatures globally and cause widespread famine, has been well documented. We talked a lot about the health effects of war today, and there's a lot of specific measures that can be used to reduce malnutrition during war, to help prevent communicable diseases and so forth. But the only way to eliminate the impacts of war on health and the environment and on human rights is to eliminate war itself. One way to thinking about the prevention of war and the promotion of peace is this triangle, starting in the lower left, finding ways to resolve disputes before they become violent, reducing the root causes of war, and strengthening the infrastructure for peace. I know it's easier to say this than to actually carry it out in practice, and all these measures take persistence, and they're hard to carry out in practice. But looking into more specifically in these 3 areas, we're talking about resolving disputes nonviolently. We're talking largely about diplomacy, arms control, and measures to diffuse conflicts and to prevent the spread of violence. Gary Slutkin, who's an epidemiologist from Chicago, many years ago worked in East Africa on problems like tuberculosis and cholera. And when he returned back to Chicago in the early 2000s, he noticed that the patterns of gun violence in Chicago mirrored the epidemiologic patterns of the spread of infectious diseases in East Africa. And so he started not only studying gun violence in Chicago from an epidemiological perspective, but also developed measures, actually applied pre-existing public health measures to prevent conflicts in the community from turning into gun-related assaults and gun-related mortality. And some of you may know Gary. He started an organization called Cure Violence Global, which is now operating throughout many cities in the United States and a number of other countries. There have been a number of independent evaluations of this methodology, which is basically applying public health measures to look at the presence of disease in a community and looking at ways to interrupt transmission of disease, in this case, and that disease being violence. Another set of measures that can be taken to prevent war is addressing the root causes of war: militarism, socioeconomic inequities, ethnic and religious animosities, poor governance, and environmental stress. Some people say we live in a militaristic society, and we don't need to go too far beyond, in fact, the world of public health, where we use militaristic terms to describe the work we do. We target populations. We have wars on drugs and wars on cancer. Even the main office of the American Public Health Association is called headquarters. And so we need to be mindful of the root causes of war, and as a society, as a global society, to address those root causes. And finally, strengthening the framework for peace, rehabilitating nations and reintegrating people after war has ended, establishing truth and reconciliation commissions where appropriate after war, strengthening civil society and the rule of law, increasing citizen participation in the decisions that affect them, and importantly, holding aggressors and aggressor nations accountable for the damage they cause. Two other things about building a infrastructure of peace is that for peace to be sustainable, it needs to be built from the bottom up, not to be imposed from the top down in places like New York and Washington and other places where international organizations have their offices. Ideally, peace is built from the bottom up. The other thing that's been found in many situations is that when women are directly involved, in fact, lead the peace process, peace is more likely to be sustainable. It's often the case, it's typically the case that men make war and that women are most instrumental in building peace. So we need to remember not only to focus on the horrors of war, but think about ways that war can be prevented and peace can be developed and sustained. In my book, From Horror to Hope, I talk not only about these horrors of war, which indeed can be overwhelming, but a lot of reasons for hope. And I am optimistic. I wouldn't be speaking to you today if I was overwhelmed by all the horrors of war and pessimistic about the future. Some of these reasons for hope include the fact that many disputes are indeed resolved without violence. As an example, there are 250 river systems in the world that are shared by 2 or more countries. Indeed, there are outbreaks of violence from time to time around the use of these water supplies, but in fact, most of these shared river systems has been accomplished through compromise and treaties and through nonviolent means of resolving disputes over water. Second is the increased recognition and respect for and the protection of human rights. Another reason to be hopeful is improved humanitarian assistance, which is much more systematic and professional than it was even a couple of decades ago. The effectiveness of many international treaties. As one example is the Chemical Weapons Convention. We all know about the use of chemical weapons in Syria on a number of occasions, but indeed the Chemical Weapons Convention has been highly effective in preventing the use, in fact, preventing the stockpiling of chemical weapons, the vast majority of which have been destroyed in the last 3 decades as a result of the Chemical Weapons Convention and the widespread acceptance and approval of nations that have signed on to it. And the fact that many people and organizations are working to prevent war and to promote peace. So at this point, I'd like to do another eyes closed exercise with you. I'd like you to close your eyes again. And this time, I'd like you to imagine what it would be like to be living in a world without war. Keep your eyes closed. What do you see? How is your life different than living in a world where military force is used to resolve disputes among nations? What are you no longer worried about? How can the resources that were previously used for military purposes now be used? What do you now see as possible? And when you have a clear picture of a world without war, you can open your eyes. Dan?
Dr. Prabhakar has a question for you, Dr. Levy.
Thank you.
Go ahead, Prab.
Yeah, terrific presentation, very large amount of food for thought. One of the things that I could not help but think in parallel to your presentation was, we are talking about war only in terms of violence, bombing, and the kinds of wars that we are seeing in Ukraine. But one of the things that I know, I don't want my colleagues to misconstrue the question I'm going to ask. The economic warfare that's going on right now is one aspect of it. And really, that's not what I'm talking about. In general, very rich countries have imposed unbearable economic burden on poorer countries throughout the last 50 plus years as a means of bringing them down to their knees. And the consequence of that are not as gruesome and as visually dramatic as dropping a bomb is, but the effects are nonetheless quite severe. But it may take a little bit longer, and the real toll can never be measured because of the way things are done. So what are your thoughts on that? Because I noticed that you did not address the consequence of so-called peaceful economic warfare, which is never peaceful.
Yeah, yeah. You're absolutely right. And I appreciate very much you bringing up the issue. In a sense, as some of what you're talking about is the structural violence that occurs throughout the world as a result of, as you say, policies of international lending organizations and so forth, and of governments. You're absolutely right that kind of, and if I can put the label structural violence, I mean, I know that may not exactly define what you're referring to, but that kind of violence indeed has profound effects worldwide, and we don't, as a global society, we don't recognize that as violence as I think we really should. One definition of violence is, and I'm not going to say it exactly right, but it's in effect saying preventing people and communities and nations from achieving their full potential. And when we begin broadening the definition of violence, that is indeed violence, and it has profound and widespread effects. I don't know if you wanted to comment further on that, if you'd like.
No. Thank you very much. Just wanted.
I appreciate that very much, and you're absolutely right, and we need to be giving attention to that as well.
On a lighter note, Dr. Levy, I told you so much food for thought. On a lighter note, in the triangle that you had, and how do we bring ourselves to try to discuss problems and solve without lobbing bombs? I think it has, being a biology, it has something to do with our lack of full evolution. I think we are still evolving. And I think we have not evolved as a species to really become so sophisticated that we can reason all the problems, and sort it out over a glass of wine and bread. But I think there is an evolutionarily, backward, animalistic, reptilian complex that that gives us this flight or fight, and we end up fighting most of the time. So I think there is an evolutionary component to this. I love your aspirational goals. I want you to know I'm very committed to that, and therefore it's good to know people like you with the international visibility you have think along those lines. So I'm eternally grateful to you. But at the same time, I think there is an evolutionary component to this, because we haven't figured out and we haven't evolved sufficiently to be able to. Some of us think we have, but as a species.
Right. Yeah.
So anyway, I just wanted to make that.
No, I couldn't agree with you more. You mentioned reptiles, and I'm no biologist, okay, or I don't know very much about animal behavior, but I wouldn't want to give animals in general a bad name. I mean, and this is not being critical of you using the term, but in some ways, humans as a species are more hostile to each other than most animal species, most other animal species.
Absolutely.
Thank you for your comments.
So thank you for everything you have done.
Sure. Yeah. Thank you.
Barry, I'm off of mute, so I just wanted to raise another point, bringing it back to the root causes of war, specifically the environment, and not just what's happening in Ukraine. But the International Union of Concerned Scientists issued a second warning to humanity about sort of ecosystem collapse that could happen in the next 20, 30 years. And that, coupled with increasing populations in parts of the world where the ecosystem services are going to be most stressed, seems to predict that there's going to be a lot more conflict in the future. And I'm not sure how we can address these issues other than
Mhm.
addressing some of the major problems like climate change and resource.
Yes, yes. And as you're pointing out, Dan, everything in a sense is connected to everything else. And we have to develop some kind of holistic approaches that cross these different areas of concern. But absolutely, it's interesting. Let me just comment briefly that there's evidence that climate change, at least in some situations, leads to war and other forms of violence. And clearly, as I pointed out, one small aspect of the fact that violence, and particularly military use of fossil fuels, intense military use of fossil fuels, contributes to climate change. So there are, as you point out, a lot of connections here between violence and the environment and climate change.
Also one more point is some of our politicians look at these conflicts around the world and just call them local territorial disputes, yet their impacts are really global in terms of impacts on the economy, rising inflation, decreased access to food, decreased access to energy. I think the war in Ukraine alone is going to impact the global economy by over $2 trillion. And these have
Absolutely.
major indirect effects in terms of how we're going to allocate the resources that we have to fighting other
Yeah.
kinds of problems.
Yeah, absolutely. Yeah, well said. There's some other questions?
Yes, Ron Hershow has a question for you.
Yes, thank you. Thank you, Dr. Levy, for a great talk. I was hoping that you could comment a bit on the challenge of building resilience and local health capacity in low and middle income countries. Building such capacities has the potential to mitigate some of the impacts of war on health and aid recovery in the aftermath of conflict. And I guess my question is, how can we best stimulate the political will to develop Marshall Plan-like efforts to strengthen economies in post-conflict areas to prevent spiraling descent into these worsening health crises?
Yeah. No, it's a very good question, and a hard one to give a simple, brief answer. I think part of the answer may be, and you use the term Marshall Plan, some major effort and real commitment by the global North, basically by the high-income countries, to contribute financial and human resources to enable countries in the global South that have been affected by war to develop, to rebuild and develop sustainable economies and so forth. But I think more often than not, what we in the global North can do that might be more effective is to support the efforts from the global South, the indigenous efforts, so to speak, on how they want to rebuild, how they want to strengthen their societies, and listening to what they need before we develop plans or engage in some kind of external aid effort. I think it really has to be the countries themselves engaging in efforts to rebuild after wars, and to we in the United States and other high-income countries looking to see, first of all, listening to see what is needed and wanted, and then helping those countries to help themselves. I think all too often, not only in wartime situations, but in other situations, we in the global North have developed what we see as what look like reasonable solutions or responses to needs that are not appropriate or just not sustainable in the long run. I wish I had the reference right at hand, and I can provide it to Dan afterwards. But in the course of my writing the book on From Heart to Hope, I came across a book actually that was written about how people and communities that have been affected by war can best protect themselves, and how in fact many of them are in fact already doing that. in the absence of external aid, or using the resources and the ingenuity that they have. So I think there's a variety of approaches that need to be taken, but we need to be mindful that the people who know best are the people who are living in those countries and experiencing those challenges, and asking to see if we can be helpful, and listening very carefully as to what the needs actually are.
I totally agree with that. I didn't mean by saying Marshall-like plans to feed into that notion that the rich countries have to rescue the poorer countries and come riding in on white horses to do so. I meant that we need to partner with those countries to build local capacity. I think what some of your remarks about building sort of an ecology for peace really require strong economies, strong health systems, and a steady food supply in these countries. And only when we achieve that can we really hope to have an impact on these war-related catastrophes.
Yes, and I apologize for misunderstanding your question, but you're absolutely right. And I think, as you just pointed out again, that strong health systems are an important component of that. And by the way, those strong health systems may look quite a bit different than health systems in Chicago or Boston or Western Europe and so forth. We need to understand that the way countries perceive their needs and ways of meeting them need to fit their appropriate to what they see as important and sustainable. So, but thank you very much. I agree very much with your points.
Okay, we have another hand raised. Keith, go ahead and unmute yourself.
Hi, Dr. Levy, can you hear me?
Yes, I can.
Yes, thank you for a terrific presentation. I wanted to go back to, you were talking about ways to strengthen infrastructure for peace, and you talked about the Truth and Reconciliation Commissions. And just a brief side note, I lived in Rwanda for a couple years, about 20 years after the genocide, and I learned about their Truth and Reconciliations there, and they really did credit, the Rwandan people did credit the commissions for helping the country recover and becoming what it is today. I felt very safe there when I was living there. So I did want to ask, are you seeing those appear more in post-conflict areas, those Truth and Reconciliation Commissions? And if not, what's stopping them from being established?
Yeah, I don't fully know the answer to your question. It's something that I have not carefully monitored, but I appreciate your pointing, your direct experience of having lived in Rwanda after those Truth and Reconciliation Commissions had done their work. And I know they have been very effective in a number of situations. I forget the exact count. I think it's more than 25 at this point. And each war is different. Each country where wars have happened is different. And Truth and Reconciliation Commissions may not work in all situations, but indeed, they have been extraordinarily helpful and certainly need to be considered in the aftermath of war.
Great, thank you so much.
Barry, another question. I mean, war is a crime. We'll all agree on that. But at some point, certain actions during war become crimes against humanity. Recently, Putin has had a warrant issued for his arrest for crimes against humanity for the abduction of Ukrainian children. In your view, at what point do these actions raise to the level of real crimes against humanity?
Yeah, so I mean, this is a legal question. I gave an interview about a year ago, and the very first question was posed to me was, is what's going on in Ukraine, a genocide. And there are very strict legal definitions in terms of what's a crime against humanity, what's a genocide, and so forth. I mean, there's no question that what's being done is wrong on a massive scale. It appears to be a massive violation of human rights. But the actual definition of a crime against humanity is a definition within international humanitarian law, international human rights law. I wish I could give an exact definition. Perhaps somebody else who's participating today could do that, but unfortunately I cannot. But it's I don't know if there's anything more I can say on that. Dan, do you want to say more about the situation in Ukraine and from your perspective, how these crimes and human rights violations are being investigated?
Well, there are many crimes going on. I'm not sure from a legal standpoint what gets raised to a crime against humanity, but some of the things that you had mentioned, there's a deliberate attempt to destroy Ukrainian cultural institutions, destroying churches, museums, schools. So it's an attempt to basically eradicate the Ukrainian identity. And Putin pretty much said that in his manifesto about 2 years ago. Other things that are happening are the use of sexual violence against the population, which is horrific. We've seen the torture and massacre of civilians in places like Bucha and Izium. And I mean, I'm just so close to it that these things, curdle my blood. And it's also it's an assault against the world order that has brought us relative peace since the Second World War. I mean, there hasn't been major conflicts between two states like this since the Second World War. So it's a complete trying to turn the system that we've had upside down. So I think that what we're doing, what the West is doing to support the Ukrainians against this illegal, brutal invasion is absolutely the right thing to do.
I agree very much with what you said. One of the things that's being done, might say on an individual scale in the war in Ukraine, is that many of these apparent war crimes are being documented because so many people have cell phones, and in other ways they're being documented. And so there's a lot of evidence that's being gathered that could be presented to international tribunals at some point, and to hold the aggressors accountable.
Right.
Further questions or comments?
I'll just bring up one more point. We talked about radiation and threat of use of nuclear weapons, which, you're having a nuclear blackmail now with the transfer of tactical nuclear weapons to Belarus. But one of the real issues currently is the invasion or the takeover of the Zaporizhzhia nuclear power plant, which is one of the largest nuclear power plants in Europe. And there have been several disruptions of electrical power to that plant. And as you know, if you disrupt the electrical power to a nuclear reactor, what's going to happen, you can't circulate the cooling water, and you're going to get overheating, and you're going to get potentially a Fukushima-like explosion, releasing primarily radioiodine, radiocesium, and other radionuclides. With the Zaporizhzhia nuclear power plant, it's estimated that such an accident would spread over 2 million square kilometers and affect over 1 million people, not just in Ukraine, but throughout the region. So this is a real current threat. And I think with the Ukrainian counteroffensive, which is likely to begin sometime in the spring, we're going to be hearing a lot more about what's happening at that particular plant.
Absolutely.
I have another question, Lisa Ray Murray, if you want to unmute yourself. Arlinda Ray Murray, I apologize.
Hi, Barry.
Hi, Linda.
You know, this is such a difficult topic, and I wanted to ask you whether or not you believe that we in the United States have a special responsibility because of our role in supporting and in many instances causing these wars around the world. I want to raise something not in opposition to what Dan said, but a real query. You know, what's going on in Ukraine, I don't know what the legal definition is to me, but to me it's clearly war crimes and crimes against humanity. But are we paying them special attention? I don't agree that these same kinds of things, kidnapping of children, turning children into soldiers, all the crimes that we've seen in Ukraine, we've seen in other conflicts around the world, some of which our government has been a major player in, and certainly where we've supported various proxies or other. Do you think we as Americans have a special, and especially those of us in healthcare, have a special responsibility and role to play in trying to, in fact, build the foundations for a peaceful world?
Yeah, absolutely. I'm glad you raised these issues, Linda. You know, the war in Ukraine is atrocious in many respects, and at the same time, there are other wars and armed conflicts throughout the world. I said at the very start of my presentation that in the last year, for which there's full year for which there's data available, there were armed conflicts in 46 countries, and they vary greatly. But in many of those countries, and first of all, these conflicts are out of sight, out of mind. They don't make the media in the United States. And indeed, the United States has played a role in many of those countries, in many of these wars, in fact, supplying you know, weapons, or actually, you know, accounting for the conflict in the first place in one way or another. So indeed, I think we in the United States have a special responsibility, and those of us in healthcare have a special responsibility to, first of all, learn more about these situations and do what we can to bring these to public attention and use all the ways we have at our disposal: education, research, advocacy, solidarity, measures of solidarity with health professionals in those countries. So indeed, I do believe we have a special responsibility in this area. Linda, do you want to say anything further on this?
I think I guess I'm not muted. I'm sorry.
Yeah.
Well, no, I just think that becomes really important. And just, you know, for some history, I will say this just as a personal comment. You know, I'm old enough to remember hiding under my desk while the United States, you know, practiced nuclear bombs being dropped on us. And I'm going to tell you, my fear about that has come back to me as an old person. And so I'm really concerned that to the extent that we do not understand the history of the world and history in Europe, and don't understand the real danger we face from a public health point of view globally around all the conflicts that really wars, you know, that you've mentioned, I'm concerned that we underestimate the impact. And while it's clear with this discussion of Putin threatening tactical nuclear weapons in the Ukraine scenario, that danger exists all around the world. And actually, at some level, one of the real dangers from the Ukraine war is that the tolerance for actually threatening the use of tactical nuclear weapons in other settings, in other parts of the world, gets lowered. And the possibility of those being used in other scenarios really increases.
Absolutely.
And so I really think we have an obligation to in fact, insist on the stopping of these conflicts all around the world. And that's difficult. And it does mean addressing in a clear way the powers that are making money off of the wars and the powers that are making money off of the present world order. And if we can't address the impact that climate change is causing around the world, if we can't address the impact that oppression and our historical oppression is causing around the world, then I really worry about our ability to stop war.
Yes. Yeah, well said. I might just add to what you said, is that it's not only we as individual health professionals in the United States and other countries in the global north, but also our universities and other institutions where we can potentially leverage the power of those institutions and the resources of those institutions to achieve the ends that you and I are talking about in terms of preventing war. Thank you, Linda.
Okay, Linda Humaden, I'm going to let you ask your question.
Yes, hello, can everybody hear me?
Yes.
Thank you so much, Doctor, for going into detail about this. And I definitely want to thank the prior speaker, Linda. My name is Linda too. Definitely hit points that I also wanted to discuss. Being a first generation Palestinian, this is very dear to my heart. And one thing, and Linda, you're right, history plays a very huge role. And I still feel like history is being repeated, and it's being, until we are able to address the historical oppression and colonialism and how it's still being underway in various countries, especially the Middle Eastern countries and Palestine in particular, who's still under occupation until this day. Again, there is a very strong need for us to come together and address these issues historically, because whether we like it or not, history plays a major role in colonialism and how certain people are still oppressed under this day. So I'd like to hear a little bit more about what you think, Doctor, on this topic of colonialism.
Yes. Well, I appreciate very much your raising this point. Related to what you're saying is that it's sometimes said that the victors in war end up rewriting or revising the actual history of what truly happened. And I think not only do people need to understand what's written about in terms of history, but to delve beyond the so-called official history that comes from the media and the U.S. government and other powerful institutions to find out what really has occurred and what is still occurring, and to have a better understanding of why it's occurred and what needs to be done to use that information to prevent war and promote peace. So I couldn't agree with you more. I mean, I think we need to understand the underlying history, the underlying roots of problems, and what's really going on in many situations that usually does not get reported in the media or in the official history books and so forth.
Thank you so much, Doctor.
Rachel Rubin.
Hi, Rachel.
Yeah, hi, Barry. Thank you so much for a tremendous talk today. Yeah, I mean, there's so many different threads here to comment on, but couple of points I wanted to ask you about is that in the early 90s, I worked and lived in Mozambique for 2 years during the last year and a half of their counterinsurgency war and the first 6 months of the ceasefire, which actually did sustain itself to this day, despite a variety of issues happening in that country since then. But the ceasefire is held, and they had peace. But to live through that and to see all of the consequences of war, as you have described very clearly today, is that the one thing amongst many that struck me is that when I got to Mozambique, people were fed up with the war. Not that you don't get fed up with war immediately, but this had been going on for this counterinsurgency war. People call it a civil war, but it wasn't a civil war. It was an externally funded war of disruption. After the 400 years of colonialism ended in that country, South Africa had strategic use for Mozambique and decided to disrupt the then newer socialist government that had won its independence in 1975. And so this counterinsurgency war was being funded by South Africa, the apartheid state at that time. But by the time I got there, people were saying, we don't care what compromises Frelimo makes. You don't care what the government has to do. There has to be peace because the country has basically been destroyed. It's building infrastructure, its schools, the natural environment, et cetera, et cetera. And so there was finally a ceasefire declared, but at the expense of them really, Mozambique having to change the name of their country. They had to change their name from the People's Republic of Mozambique to the Republic of Mozambique in order to get international resources to help build the country. They finally caved to taking World Bank and IMF funding, where they had been putting that off for quite a while, even during the time of war. And to get USAID aid in particular as part of the ceasefire and going forward, is that they had to change the name of their country. They had to privatize or allow a private practice option in their medical system and in their educational system. So they had to allow a certain level of privatization. Turns out that didn't work because the country was way too poor and couldn't even support two levels of care, the private and public, though that has evolved now 30 years later. But I'm wondering if you could comment about, and this sort of follows on Linda's question, is that, or comments, is that what the United States and other Western powers have done, especially in developing nations that have had these wars of liberation in particular, to reshape and change their countries into a mold that turns them into capitalist nations when that's not what they want to do.
So I appreciate your describing what happened in Mozambique, and indeed has probably happened, and I know has happened in many other countries in the world. And again, so much of this is out of sight, out of mind for the American public, even for many people who, people who are working in global public health, let's say. And so I think we need to learn more about and publicize and educate, the community, educate other people working in global health about what's happening in these situations. I don't condone them in any way. I think we need to let people know what's happening in many of these situations, and the role that the United States has played, for self-serving, interests that are counter to the needs of the people living in those countries. I mean, that's happened worldwide in many situations. It needs to be addressed. It needs to be, people need to know more about it, and so forth. Let me ask Rachel a question back to you on this. Given your experience there, do you have some insights as to what we can do as a nation, as we can do as a global public health community to prevent this from happening, or to shine a light on what's going on?
Yeah, that's a good question. It's tough. I think that one thing that's interesting, that's sort of part of this, is that the non-governmental organizations that do relief work throughout the world, and that also includes the UN, which is sort of government-supported organizations, go in and sometimes they set up their own sort of parallel structures of aid and support in these countries. And I think that that's not the right model. It doesn't mean that there shouldn't be aid organizations, but I think that the aid organizations should be embedded or working in cooperation with the local government structures. When I went there, I actually was supported by UNICEF and by a solidarity organization in the United States, but I was hired directly by the Ministry of Health. And so the idea that I wasn't setting up some private project that then would not be self-sustaining when I left, I was embedded in the medical and public health systems of the country and worked within those structures. And I think
Yeah.
that that's very important, to not just go in and do relief work, which is incredibly important, you know, but
Mhm.
not really understand the culture and the people and become part of the community there. You're there
Right.
and you put your feet down on the ground for a short period of time and then you're gone.
Right, absolutely. Yeah. Yeah. Absolutely. Thank you very much, Rachel.
Yeah, Dr. Levy, this is Prabh again. You know, again, one of the statements you made is how do we even use the terminology, war on cancer, war on drug addiction, and whatever. So I mean, if you, and I was very also taken by constant reference. This is the biggest war since World War II. This is the most horrific war since World War II. I mean, that is simply betrayal of the history since World War II. I mean, you know, Iran-Iraq war, you know, caused millions of people death on both sides of the warring factions. The Bangladesh Liberation War, which somebody else calls it by some other name, you know, literally 2 million people died. And for us to continue to pretend somehow this is the biggest war since World War II, I think number one, doesn't do justice to it. Number two, how do we characterize the other wars? We call them ethnic wars. We call them tribal warfare. Or it is a Shia versus Sunni war, and Jews versus Arabs. You know, we use these kinds of terminologies to describe, you know, other wars. Whereas when it comes to the war right now that happens in Europe, you know, we call it, oh, it is autocracy versus democracy. I mean, I think these verbiages have profound meaning behind that. And when we talk like that, no wonder 1/3 of the world population today is not supporting the Ukraine war. In another 1/3 of the population is almost couldn't care less. And 1/3 of the world population is offended. So this, I'm not criticizing anything. I'm stating facts. So if you look at why the world is so sort of lackadaisical about what's going on in Ukraine, which is horrific, which is unbelievable, and we haven't been able to convince, you know, bulk of the world that this is a war that is worth, you know, pushing against and helping Ukrainians and so on and so forth.
Yeah.
I think there is this tendency to assign different titles to different types of wars, and that I think that's part of the reason why people don't get, you know, aroused and hold their governments accountable, you know, particularly in the Western countries, because they cannot relate to these wars because we use different terminologies and it happens elsewhere. And of course, the media is the worst enemy for all of these things.
Yeah, you're absolutely right. The words we use, the way we frame wars, the terminology are very important. And I think we need to look at, you know, who is assigning the terminology, what is the motives. You know, I'm thinking about what could be, I hope it isn't, but an impending war between the United States and China. I think that's unthinkable. But if you look at the way the media and the U.S. government is trying to frame that conversation, it's very scary. But how situations get framed, how words are used, that's exceedingly important, not only during the war itself, but in the events that could lead to a war. And what can we do as public health workers, as medical workers, and so forth? How can we address that and again shine light on what's going on, but look at these situations in different ways with an effort to prevent war and promote peace. Thank you. Very good comment.
Yeah, I mean, just listening to what Dan said about the systematic destruction of cultural centers in Ukraine, I could look at this and say, it's not a war versus democracy versus autocracy. It's an ethnic war between Russians and Ukrainians, and Ukrainians are standing up for their cultural values, and their freedom and everything else. So therefore, please do not misconstrue me. I'm just trying to
No, I understand.
point here, very strong point here. Why didn't we call that an ethnic war, but we decided to call it a democracy versus autocracy war? It is an ethnic war because the guy is going after the Ukrainians.
Yeah, I think your overall point is a good one. Thank you.
Yep. I agree with much of what Prab said. I do want to raise one other point, is that Ukraine was the first country to voluntarily give up nuclear weapons. And they had the third largest nuclear arsenal in the world,
Yeah.
in exchange for guarantees of peace and security. If Russia is allowed to violate, which they're doing, the Budapest Memorandum, and they succeed, what's going to happen to other assurances for Iran, for North Korea? I think it's opening up a whole Pandora's box in terms of what's going to happen with nuclear proliferation in the future.
I completely agree with you. Today, Bill Clinton is apologizing for forcing Ukraine to give up the nuclear war only after so many years. So all I'm trying to tell you is that there is plenty of blame to go all around. I think we have to respect each other, and we should really look at other human beings as ourselves until we kind of grow up to that level of sophistication, intellectual sophistication, and develop the level of civility that it is required. As long as we castigate each other, oh, he's brown, he's tall, he's short, he's black, he's white. I think this instinct that we have, this crazy instinct. I think, sir, to answer your broader question, I think we have to grow out of these mindsets that unfortunately that's inculcated from birth. I mean, it's only societies can only reinforce what we are already brought up with. I think every household has a responsibility here to raise their children, in a global citizen mindset, not with national flags and all that kind of stuff. But as long as we have that, they're all vestiges of a tribal culture, so to speak.
Thank you.
Okay, I don't see any more questions. So I don't know, Dr. Levy, Dr. Horschak, if you have some final words.
I just want to thank Barry for an outstanding presentation, a very stimulating discussion. I think that we as public health professionals have a responsibility to address these issues and to try and address also the root causes of war, and to look at them. I think I agree with Prab, and we tend to look at these things fairly narrowly from our own political interests, and these conflicts and the root problems are much broader. But I think it's something that we definitely need to address if we want to leave a safe world for our children. So I want to thank Barry again for really taking the lead on this issue for the last several decades.
Thank you very much. Thanks for good to be with you all today. Thank you.
Thank you, everybody. Have a wonderful day. This recording will be available by Monday of next week.
Thank you.